First questions we had sent in before is, what's the difference between Mounjaro and Wegovy? So let's dive into that one. So both Wegovy and Mounjaro are two types of injectable weight loss medication that's available. Now, injectable weight loss medication has been available since about 2017, when the first injectable medication, Saxenda, came to the market. So some people might have heard of that. That was, again, a fantastic weight loss tool, but it was a daily injection. Next, the next injection that came to market is a medication called Ozempic. And now lots of us have heard about Ozempic. We still hear about Ozempic, and it's still a valid medication in use, but its license is for the treatment of diabetes, not weight loss. So what the drug companies did is, obviously they've got Ozempic, they're treating people for diabetes with it, they're losing weight. They brought out a sister pen called Wegovy, which is the one that's licensed for weight loss, and it goes to a higher dose than Ozempic does. So Wegovy is the version of Ozempic that is for use in weight loss. It goes to a higher dose, and it contains the active medication in it is called semaglutide. So these are a weekly injection. So it moved on from being a daily one that we had right back with Saxenda to now being a weekly injection. So much easier to manage than injecting yourself daily. And semaglutide, or Ozempic and Wegovy, are GLP-1 agonists. That's quite fancy, and we hear about GLP-1s, and essentially that is the name of the hormone they mimic in the body. So when we eat normally, our bodies are in tune to knowing when food's entered our stomach, and our stomach usually, and our gut, releases a hormone that feeds back to the appetite center of the brain, and that hormone is called GLP-1. But normally it only lasts a very short time, quite transiently, after we've eaten. So what has been done with these medications is they've modified that hormone ever so slightly to make it constantly present. So you inject yourself with it and it remains in your system. So it's constantly feeding back to the brain that you feel less hungry, that you've got less appetite, and therefore you can think a little bit less about food and take a step back, think about what you're going to eat, maybe plan a little bit better. But secondary, what they also do is they slow down how quickly food moves through your gut. So again, that creates that feeling of fullness. So you might find that your portion size goes down because just naturally you're feeling fuller when you're eating, so you'll eat less. So you've got the two ways in which this type of medication helps you manage your weight loss by adjusting what you eat. Now, we know that weight loss is not easy. You know, we specialize in helping people here. We know that diet is a key part, but not the only part. But this is how these medications work. They help with that diet part of losing weight. So then what's Mounjaro? So Mounjaro is the newest injection that's come to market, and it contains an active medication called tirzepatide or tirzepatide. I never know if I quite say it right. Everyone says it a little bit differently, but that's the name of the medication within it. Now, like semaglutide or Wegovy, it's a GLP-1 agonist, so it's a copy of that hormone, but it's also another hormone called GIP, and that means we've got two different gut-based hormones feeding back to the brain in a similar way, reducing perception of hunger, and also telling the gut that it's fuller, slowing down that transit, and therefore making you feel fuller. So they work very similarly in terms of their mechanisms of action and how they activate the innate pathways we've got in our body anyway that say we're full and that we've eaten enough, but amplify them up so that it helps us again manage that diet part. So again, they've both been available for differing times, but what we know is when a new medication like this comes to market is we have all the information from the clinical studies that have been done before it's released, so we can see the great results that they've had in clinical studies. Plus we're seeing fantastic results in patients that have been using the medication since their launch, and that's the key. So the key difference between Wegovy and Mounjaro is they contain different drugs. They're of a similar class. They're like brother and sister, but they're not exactly the same. So they both work in a similar way. And which one is right for you is dependent. There's no one that's best for you. It depends on lots of individual factors, and some people might find that they try both in their journey in weight loss. They might use one for a while and then may even change to the other. One might work better, one they might tolerate better, so you might find it, you feel better on it than the other. And again, it's not always possible to predict. Sometimes it is a little bit of get started and see which one suits you. But what's great is that we've got several available tools now that can help you find the right medication for you.